Are you experiencing pain, warmth, or swelling in one breast while feeding your baby? Or perhaps you have suddenly developed flu like symptoms with a painful red area on your chest? Many mothers assume it's just a blocked duct or engorgement, but sometimes it's more serious. Hi, I'm Shinju, a lactation counselor and a mom. In this video, we'll discuss in detail the symptoms and signs of breast infection, also known as mastitis. So, you'll know exactly when to rest, when to treat at home, and when it's time to see your doctor. We'll break it down step by step. What breast infection is, how it begins, what the early signs are, how it progresses, and how to differentiate it from other common conditions like blocked ducts, thrush, and abscess. Let's begin. What is a breast infection? A breast infection or mastitis is an inflammation of the breast tissue that can sometimes involve an infection. It usually occurs in breastfeeding women, most commonly in the first 6 to 12 weeks postpartum. But mastitis can happen anytime during lactation, even in women who are pumping or partially weaning. Let's understand how it starts. Normally, milk flows freely through your ducts, but when a duct becomes blocked or milk isn't emptied fully, milk can pool inside. This creates pressure and swelling. If bacteria, usually from your skin or baby's mouth, enter through a cracked nipple or skin break, an infection can develop. So, in simple terms, milk stasis, leftover milk, cracked skin, entry for bacteria, and weak immunity or exhaustion. These trigger mastitis. The most common bacteria, Staphylococcus aureus, it lives harmlessly on our skin, but inside breast tissue, it causes inflammation, swelling, and pain. Now, let's talk about the earliest signs. The symptoms often start subtly, and many mothers ignore them, thinking they are just a part of the breastfeeding experience. You might feel a sore or tender area in one part of your breast, often in the outer upper quadrant. A small lump or hard spot that doesn't go away after feeding. A warm or a burning sensation in that spot, sometimes painful even between feeds. Mild redness like a rash or heat flare. A general fatigue as though you're coming down with something. Important to remember, these signs may come and go initially. That's the golden window. When it can still be reversed with feeding, rest, hydration, and compresses. Many mothers dismiss this phase, and that's when things escalate. Progressed symptoms. What to watch for? If mastitis progresses without treatment, symptoms intensify quickly. You may now notice sharp, throbbing pain that gets worse during or after feeds, a wedge shaped red area extending from one spot outward. The breast feels swollen, firm, and hot to the touch. Fever, usually above 100.4 degree Fahrenheit, sometimes accompanied by chills. Body aches, just like flu. Nipple discharge, which may be yellow, green, or pus like. Nipple cracks, sometimes bleeding or sore. Swollen lymph nodes, especially under your armpit on the affected side. Decreased milk supply from the affected breast, sometimes temporarily. Refusal to feed from that side due to slower letdown or taste changes. You may also notice general malaise, a feeling of weakness, being unwell, or not able to get out of bed. Some others even report night sweats, nausea, or shivering. This is your body fighting the infection. Difference between plugged ducts and mastitis. Many moms confuse plugged ducts with mastitis. So, how do you tell the difference? Plugged duct. Painful lump in one area, no fever or systematic symptoms. Feels better after feeding or massage. No skin warmth or redness or very mild. Mastitis. Pain and red, warm skin over lump. Fever, chills, and body aches. Worsens over 12 to 24 hours. Often needs antibiotics. A plugged duct can turn into mastitis if not relieved. So, even a small lump should be addressed early. Thrush versus mastitis. Important confusion. Breast thrush, candida infection, can also cause breast pain, but the difference thrush, Sharp burning pain inside the breast, especially after feeding. Nipple appears shiny, flaky, or pink. Baby may have white patches in mouth. Mastitis. Pain is in breast tissue, not behind the nipple, accompanied by swelling, redness, or fever. Nipple cracks may exist, but often with skin heat or body aches. Knowing the difference helps you get the right treatment. Thrush needs antifungal, not antibiotics. Signs of breast abscess when it gets serious. If mastitis is left untreated or not fully healed, it can turn into a breast abscess. An abscess is a collection of pus inside the breast tissue. Signs include a large, hard, hot, and painful lump. Skin over the lump may appear shiny, tense, or stretched. Fever may remain or worsen. Pus may drain from nipple or skin. Feeding becomes extremely painful. Abscess requires medical attention, usually ultrasound to confirm and drainage either via needle aspiration or minor surgery. Sometimes moms with abscess can still continue breastfeeding from the other breast and even the same breast if properly managed. When to see a doctor? Always seek medical advice if your fever lasts more than 24 hours. Pain and swelling keep increasing. You see pus or blood in milk. You feel flu-like symptoms and breast pain. Sometimes don't improve after 12 to 24 hours of self-care. Early antibiotic treatment can prevent complications and shorten healing. Also, consult a lactation consultant if you're struggling to drain milk or latch correctly. Poor latch is often the root cause. Myths about mastitis. Let's bust some myths. You should stop breastfeeding if you have mastitis. False. Breastfeeding actually helps clear the infection. If you take antibiotics, you must pump and discard milk. False. Most antibiotics prescribed for mastitis are safe for breastfeeding. Mastitis means you're doing something wrong. False. It can happen even if you're feeding perfectly. It's about drainage and timing. Mastitis can be painful and overwhelming, but the earlier you recognize it, the easier it is to treat. Keep listening to your body. Notice the small signs. Seek help early and don't hesitate to talk to your doctor or lactation specialist. In the next video, I'll be covering how to treat mastitis naturally at home plus when you need antibiotics. So don't forget to subscribe and hit the bell icon. If you found this video helpful, please like, share and drop a comment below if you have experienced any of these signs. Stay strong, Mama. You're doing better than you think. See you in the next video. Thank you. Bye-bye.